It's your girl Nikita.
It's your girl Tash.
And you're listening to Two Chickpeas in a Podcast. Today, we'll be in conversation with Dr. Ranj Singh, who we're delighted to have on this special podcast episode, talking all things brown, but a very, very important conversation is looking into the signs and symptoms of cancer. And looking at the importance of body awareness and seeking help if you need it, if you find any symptoms come up in your body, and encouraging you to see your GP and doctor. So Dr. Ranj Singh, as well as a TV personality, he's also an author, a columnist. He is a NHS clinician and is trained in London before working in several renowned hospitals. He specialises in children's health and is a member of the Royal College of Paediatrics and Child Health. Regularly appearing across British television screens, he's gained a variety of opportunities from presenting Get Well Soon on the CBeebies, as well as appearing live on This Morning. Currently, he's a resident doctor on BBC One's leading daytime series, Morning Live. Dedicated to his healthcare profession, he aims to spread awareness for mental and physical well-being. So welcome to the sofa, Dr. Ranj Singh. You're live on Two Chickpeas on a Podcast.
Oh, thank you for having me. Very comfy sofas, by the way.
Very comfy sofas.
Really
We're
nice.
happy.
I like this.
Thanks. Yeah, we put in a word with our podcast. We made this happen, people. We are here to talk about cancer, which can be a really hard conversation to have sometimes. Can you tell us a little bit about the NHS earlier cancer diagnosis campaign?
Yeah, so you're right. Cancer is a scary word, isn't it? But it's something I think all of us need to think about because so many people could be affected. If we're not affected ourselves, somebody we know will be.
Yeah.
And it's especially important, I think, for certain communities to be able to talk more about it. So the NHS England has relaunched the earlier cancer diagnosis part of its Help Us Help You campaign. Help Us Help You has been going on for ages. And the emphasis right now is on people to be aware of symptoms that they might be having that have been worrying them that potentially could be a sign of cancer. The chances are they're probably not, but you won't know unless you go and speak to someone. Your job as a member of the public is not to decide if you have cancer. Your job, hopefully, is to pick up on symptoms that might be and go and speak to a professional. And like I said, chances are, most commonly, it won't be cancer. But if it is, it's so important to know early, okay? And we know that certain communities don't come forward for various reasons, especially for things like this, especially our community. And that's why I'm taking part in this, because I want more of us to be confident enough, to be brave enough to come forward and say, I'm a bit worried about this. Could I please be checked out?
Absolutely. And like you said, it's our communities that are most affected, but other communities around, you know, if we're talking brown community, it's a lot of, I mean, who's more affected overall? Is it men, women? Is it all of us that need to take more care?
Yeah. I think everyone should be aware cancer and potential signs and symptoms, but don't freak out about them. Don't worry yourself too much. We know that people over the age of 50 are more likely to develop cancer. Those from working class backgrounds and people of colour. So we're talking about Black and Asian, South Asian communities. They are at risk from certain types of cancer, but we also know that they're at risk also because they tend not to come forward.
Right.
So they may not be more affected, but they just might be less likely to speak up about it, and therefore they may not get help till a later stage and their outcome might not be as good because of that. The reason we're pushing all of this now, though, is that the earlier you get diagnosed, if it is cancer, on the unusual chance that it is cancer, the earlier it's picked up, the higher your chances of a good result. So the higher your chances of getting treated, the higher your chances of getting through it and surviving it and possibly even curing it.
Absolutely.
Okay. And that's why I want everyone to feel confident to come forward, but particularly our community who we know is less likely to do so.
And what do you think some of the barriers are, like in the South Asian community, in them coming forward?
Yeah. Part of it is cultural, right? We don't really tend to talk about feelings and how we're feeling necessarily as much as other cultures might do. The second part of it is that I think there's a whole stigma around the word cancer because we automatically assume it means something bad. We don't necessarily appreciate that actually a lot of cancers are treatable, even if we may have heard bad stories or experiences of other people who haven't had a great result. And those stories tend to stick, whereas I think many people don't appreciate the sooner you get diagnosed, the better your outcome. There is a big thing around blame. Yeah. Really is. Like, have I done something bad to deserve this? Or is this a punishment for something? So there's that kind of almost magical thinking. Or sometimes it's faith-based thinking. You know, is this a punishment from God? Or something like that. And I think because of those sorts of things, people don't come forward because
they've maybe like accept their
have I done this? Is this my fate? The other thing is that some of these cancers are personal, they're intimate, they affect parts of your body that we don't talk about very often. As South Asians, we don't talk about sexual health very much. As South Asians, we don't talk about certain body parts that often, and that's men and women. And we need to get used to talking about those icky things that we may not necessarily want to. A classic example is I won't sit at home with my parents and chat to them about boobs because it's just not the done thing. It's culturally not a done thing. But I want them to be aware of those sorts of things and the issues that can arise. And we need to normalise those sorts of conversations a bit more, I think. I'm not necessarily saying go out and all start chatting about boobs. But people just need to be a bit more comfortable when they're worried to come forward and say, I'm concerned about this. So all of those reasons really combined, I think, make certain communities less likely to come forward.
Yeah. No, and I think that is a great point because then we know how to kind of support each other. Yeah. If we're talking about things, we can then come forward and be like, you know what, actually, let's go to the doctor. Let's just go to our GP. Whereas, you know, I feel like as Asians, South Asians in our community, where we try and get on with things, we're not necessarily thinking about ourselves. We're always thinking, okay, how can we move forward and carry on with our day? And it just becomes this thought in the background. So actually, that's a really, really nice thing.
And something that we've done since starting the podcast is try to be sort of practice what we preach and be those people to start the conversation that is really awkward to have. So, you know, before I would never talk about periods with my uncle. Like, I've got to now. It's like part of my health. I want you to understand me as a person.
Okay.
You have to do that. And as much as they felt uncomfortable to begin with, I think when you break it down, they're like, oh, yeah, like, I should know about this. Like, absolutely. I do want to help look after you.
Yeah.
Yeah, just got to be that one brave person.
Just lifting the lid on some of those taboos.
Yeah.
You know, they don't need to be taboos. We're talking about health here.
Yeah.
You know, health is really important. And there's no embarrassment in that. There's no shame in that. What there is, I think, an unfortunate side in is not seeking help and then ending up in trouble because of it. Yeah. Because that is completely unnecessary.
So we talk about kind of what we, the shame. But what is it actually that causes cancer? Is there something specific? Is it something that we're born with?
It's really hard to say because cancer is not one thing. Cancer is a group of hundreds of different conditions that affect different parts of the body, and they can affect people in different ways, and there's lots of different potential causes that could contribute. There's some of the more obvious ones, like lifestyle things. You think about things like smoking, obvious, right? Excessive alcohol intake, being very obese, that kind of thing. You might think, okay, those sorts of lifestyle factors definitely contribute, but sometimes we just don't know. Many cancers, we do never find a cause for it. Some people are increased risk because they've got a family history, breast cancer being the classic one of that. But most of the time, we don't find a cause. And I think that particularly in our community, people think, I've done something wrong, that's why I've got cancer. And there's that sort of feeling of embarrassment and shame because of that. Don't feel that, because I'm telling you as a healthcare professional, for most people, we do not know what causes your cancer. But what we do know is that if you come forward and get help soon enough, we could help you. We could potentially turn this situation around. that sort of guilt is going to take a while to lose. We're very good at feeling guilty in our community. Guilt is used so much in so many things that we get used to it. You know, people talk about Jewish guilt. Asian guilt is exactly the same thing. You know, it's used as a tool. We need to lose that, I think.
Yeah. Actually, you know what? I always use the term of my Catholic guilt, but I've just got Asian guilt like everyone else. You know what I mean? I've just
Catholic guilt. Yeah, there you go.
Yeah, I've just got Indian guilt, guys. So what happens if cancer is diagnosed early?
The earlier it's diagnosed, the more likely you are to be able to be treated and the more likely you are to be cured. Simple as. There you go. If you do have a symptom that might be suggestive of cancer, the thing you got to remember, and we'll talk about the symptoms in a bit, but the thing you got to remember, chances are it's still not cancer, okay? So please don't feel scared. Like if you've got a niggling symptom that's worrying you and you're like, oh gosh, I think this might be something bad, the odds are it's not, okay? But come forward early enough and you're more likely to be treated, you're more likely to be cured. Over 83% of people will survive cancer if it's caught at the earliest stage. So your odds are, okay, if it does happen to be something a bit more sinister, if you've come forward early enough, odds are you're going to be absolutely fine. That's what I want people to do, is think about that in your head, is that I've got this concern, this worry, this panic in my head, but I've got to speak to someone, because if it stays in here, it doesn't help anyone. It doesn't help me, it doesn't help anybody else. But if I talk to someone, potentially, if it just does happen to be something sinister, the results could be so much better for me.
So what kind of things should people be looking out for in their body if they are concerned about something? What are some of the things that might appear or happen in your body?
It's impossible to give you a list of everything, because like I said, we're talking about hundreds of different conditions that affect people in different ways. But the kinds of things you might hear in health campaigns online or on screen are things like a cough that lasts for longer than 3 weeks, or an existing cough that's changed. Again, like I said, loads of people have coughs.
Yes.
Vast majority of them will not have cancer, but you'll have that tiny proportion that might or will. And those are the ones we want to pick up. Tummy trouble, persistent diarrhea for 3 weeks or more, feeling tired for no known reason, heartburn or indigestion for a long time, over 3 weeks particularly, unusual poo, unexplained pain or discomfort that doesn't go away. The common thread here is, I can't give you one symptom that's going to tell you you've got cancer, but one thing I would say is cancer symptoms don't tend to go away. That's the thing you've got to remember, which is why the emphasis is always on something that's been there for a long time. If you've got something that comes and goes, it tends not to be, I'm not saying absolute here, but it tends not to be serious. But if you've got something that's persistent for several weeks and is getting worse, then it's definitely worth getting checked out. There are other symptoms that people will have heard about that I want to point out and just underline for them as well. So if you've got one or more of the following symptoms for 3 weeks or more is the usual cutoff we give. So breathlessness, lots of infections, unexplained night sweats, unexplained or unintended weight loss, bruising that isn't explained by anything on the body, or bleeding from anywhere that isn't explainable, blood in your poo, blood in your wee, that sort of thing. Those sorts of symptoms, as well as the ones we mentioned earlier. If you've got them and they're there persistently, definitely encourage your person, your friend, your loved one to speak to somebody.
Yeah, it's really interesting that you said about like unexplained weight loss and things like that, because I think in our culture, you know, auntie tells you lost weight, you're like, oh, good, I'll get on my back for today. But now I think I will think a bit differently actually, and think like, oh, it might not be like the best thing.
I always say to people, if you're not trying to lose weight and you're losing a lot, that's not a good sign usually. And why does that happen? It's because when people with cancer lose weight, it's because those cancer cells are using up lots of energy. They're dividing really rapidly, and you get that energy from the stores your body has, and that's why you lose weight. But you lose weight when you're not trying, and you lose it fairly quickly. And something like that definitely, to me, as a health professional, rings an alarm bell. Like I said, there could be another reason for it. For instance, thyroid problems will do the same thing. That's not cancer necessarily. That's why it's important to speak to somebody and say, I've got this unusual symptom, a little bit worried about it. Do we need to look into it?
What if I'm concerned about myself or a loved
Yeah.
one? We've kind of touched on it a little bit. But I suppose I fall into that as well. Like, I do love to bury my head in the sand.
Yeah. Again, I probably can't iterate it enough. Speak to someone.
Yeah.
Speak to someone. Get it out. Get it out, whether that's a healthcare professional or if you want to sound it out with a friend or family member first, say, you can use them as a soundboard and say, do I need to see my GP? Do you think about this? NHS 111 has got loads of information on there that's, and some of it is now translated into other languages, which is good. That's always useful to take a look at if you're not quite ready to go straight to your doctor, or let's be honest, not everyone can get a quick appointment. Even before that, I think it's just being aware of your body, just being aware of this is normal for me, this is not normal for me, this is worrying me, this is coming and going, and I don't think it's, it may not be anything, but I want to talk to someone, or this has been there for a really long time and it's getting worse and I definitely need to talk to someone.
Yeah, and I suppose being vigilant as well. Like, I think about the elders in my family and they're so not aware of their bodies. I think because of this culture we have in our community of, I don't want to say hustle culture, but a lot of families are immigrants.
Knuckle down and get on with it.
Yeah,
exactly.
Don't be a burden. That's
Yeah.
the big thing, is it? And I think that's another reason why people, especially older members of our community, may not come forward, because they don't want to become the burden on the family. They're like, if I'm sick, then who's going to provide? Who's going to look after me? I don't want to be a burden on them. I think as young British Asians ourselves, we're pretty good because we've been brought up in a culture and environment where actually speaking up and getting help is the norm. Whereas I think for older generations, it's a slightly different way of thinking. They're probably thinking, I don't want to be the sick one. I don't want to be the burden. And they might have responsibilities for other people. I can't be the sick one.
Yeah.
It's probably up to us then to create, and I know it's weird because parents and older generations are supposed to look after the younger ones, but increasingly I'm finding me and people I know are looking after older generations and being the parent for them. I think we have to maybe create an environment where they've got permission to do that. I parent my parents a lot. Yeah. It's frustrating. And the number of times I speak to my brothers and sister-in-law and say, gosh, sometimes it feels like we're the ones who are parenting them and actually it should be the other way around.
Feel like that now.
Yeah, but I think a lot of British Asians feel like that. Young British Asians feel like that because we've grown up in a world and an environment where we are so much better equipped than our parents were.
Yeah.
With information, with resources, with facilities, with agency, and so we've got more skills and knowledge and information that we can use. It almost feels like now we have to pay it backwards rather than paying it forwards.
And it's not like it's necessarily easy. Like, we're having this conversation, like, yeah, just do that. But a lot, I do recognize that a lot of our elder generations are or can be somewhat stubborn in their thinking because it's all they've known. Yeah. So it takes a little while. So I suppose what I'm trying to say here is just because you've had one conversation doesn't mean it's got through to them per se. Just try again.
Yeah, these things are often more than one chat. Yeah. If you're trying to convince a family member, particularly from older generations, to get something seen to, it can often take more than one convo to do that. Don't feel like it's going to fix everything just in one chat.
Yeah. So say we have had these amazing chats and I myself or a family member, we discussed a little bit. Yeah. We've gone to the GP and then the GP refers us for more tests.
Yeah.
What happens then?
Don't assume the worst. Okay. Just because your GP is sent you for a test doesn't mean they necessarily think it is. Sometimes, so when you go to your GP, they will talk to you about your symptoms. They'll take what we call a history, work out exactly what's going on, ask specific questions that are relevant, and then they'll sort of do a risk assessment in their head. How likely is it that this person might have cancer? Yeah. And actually, sometimes we need test results to inform that a bit better, to make that risk assessment a bit better. So going for tests doesn't necessarily mean you've got it. It may just mean that we need a bit more information. So don't be frightened. And actually, knowledge is information. Knowledge is power. So they might send you for more tests to find out whether whatever you're experiencing is down to something far more common than cancer, or whether it might be something that we need to look into and take a bit more seriously. As I said before, if you've got these symptoms, they're more likely to not be cancer. But you, as a lay individual, don't know. It's not your job to know. You're not trained to know. Yeah. It's our job, actually, to do the tests, do the investigations, do an assessment and kind of say, right, okay, this is what we're thinking.
Through this conversation, though, I have been thinking a lot about, the men in our community.
Yeah.
Men in general it's a known thing, don't tend to open up, don't tend to talk a lot about things. But men especially, we touched on a little bit about, being providers, like being there for people, being strong people. But what do you think we could do? Like we're two sisters. We have a brother, exactly who I'm describing is a
doesn't
talk about anything. He's very private. What could we be doing as females to help men in our community?
Yeah,
with this,
you're right. Men across all communities are less likely to come forward, especially amongst South Asians, I think. And part of it is because of this whole provider mentality. Being the one in charge. Part of it is also like it's not the done thing. We don't talk about our feelings, which needs to change. Part of it is because people are just embarrassed about talking about certain things. There are cancers like prostate cancer and testicular cancer that affect men, and they won't ever talk about them because they're in areas that you don't talk about. And they become these taboo subjects, which is ridiculous. Yeah. So I've got a dad and a brother who's exactly like this. Getting them to do anything is frustratingly difficult. And ironically, my mum's quite the opposite. She's probably a bit of a hypochondriac. How do we do it? You can try and normalise those conversations. Depends on the relationship you have with those people in your lives. So it's not always easy to do that. I always do it with my dad, particularly. We went down the route of, well, it's really important for you to have certain checks at your age. So, and they're free, right? So I'd encourage you just to pop in and get that sorted and just get it looked at because everybody's doing it. It's the right thing to do. With my brother, it's slightly more difficult. I think we just nag him. We just have to nag him. And sometimes you do just have to nag people. But I feel like there is a generational shift that's going to happen. Okay, as younger and younger British Asians are coming through and reaching those ages, they're more likely to do it anyway. And it's up to us then, those sort of younger generations I'm referring to kind of pay it backwards and say to the people before, like, come on, these are really important things for you to do. So-and-so was on a podcast talking about it the other day. These are checks that everybody needs to have. Yeah. And the thing to remember is if a test is available on the NHS for free, particularly when we're talking about things like screening, so we get breast cancer screening, bowel cancer screening, etc. If it's on the NHS and it's being offered for free, there's a really good reason for it. Yeah. Because the NHS does not pay for stuff that it doesn't need or doesn't think is useful. And that's the reason we have those screening programs. There's loads of private stuff available out there which you pay for. Yeah. But there's a reason why that's not in the NHS, because the NHS doesn't deem it to be cost effective. If it's ended up on the NHS, like immunisations ended up on the NHS, cancer screening has ended up on the NHS. If it's there, it's for a bloody good reason. So take advantage of it. And like you were saying, more than one combo. You've got to, and do it from different angles. If different people in the family are kind of saying it, especially their peers. If you've got, for instance, let's say you've got, if it's like, for instance, with my dad, I might go to my uncle and say, can you have a chat with him? Just because he may...
friends. Yeah, what is it about?
Friends.
They don't listen to you in the family. I don't know what it is.
If you've got like a family friend who's a bit more amenable to it, sometimes they just need to hear it from somebody... Outside or somebody their age. Because they might not like being told by their kids or whoever. Maybe sometimes the approach is let's go collaterally, let's go sideways and get someone else involved. That might be the way to do it, but just keep on having those conversations. It'll get easier, I think. Yeah. As we do it more, it gets easier, right?
Yeah, we're bringing a new, hopefully more talkative culture in our community
we should
in that regard. Yeah,
absolutely should be. And I want to do away with this whole macho kind of like, if you're the bloke, you can't do this and you can't talk about that, and you can't be seen as weak, which some people, or vulnerable, which some people will perceive. So if there's something wrong with you, you must be weak and vulnerable. No, that's absolute nonsense. Cancer happens to people and it doesn't discriminate. And there may be something that has increased your risk that you might have done. Sometimes there just isn't. It's bad luck. But do you know what? You can't do anything about that. Yeah. What you can do is go forward and get checked when something is wrong. And the earlier you do it, the better for everyone.
Yeah. Do what you can do in that time. Yeah, exactly.
Absolutely.
Let someone else take the burden off you for a little bit. Don't overthink in your head, and actually just know for sure.
Yeah.
It's way worse torturing yourself in your mind
totally.
than just finding out yourself, isn't it?
Yeah, and take advantage of the NHS people. Like,
see how many times Dr. Ranj said free.
Yeah,
okay, we
like
free
99 made.
Yeah,
So good.
yeah. And let's be honest, there's a lot of things with our NHS that can be frustrating. It can be really difficult, and we've all experienced it and seen it and heard about it. But there's so much that it does. There's so much that it does. We've got record numbers of people coming forward for cancer diagnosis because of campaigns like this, and we want to carry that trend on. And like I said, it's important to get in there early.
It's really funny, actually. I say about you becoming a doctor and things like that, and then you talked about your family and families who usually encourage their children to become doctors and things. So they still don't listen to you, regardless. So you've finally done it, and I'm just like, okay, you're still not going to listen?
Yeah.
Is there any other barriers you feel like as a healthcare professional, brown healthcare professional, that you feel like from the community, like, oh, this is a barrier to people getting help?
I think there's a lot of hearsay that happens. Yeah. There's a lot of rumour that happens. We live in tight-knit communities. We have tight-knit households and we have tight-knit communities where everyone shares stuff and all sorts of misinformation gets thrown around.
WhatsApp
yes, exactly. Yeah. All that kind of thing. And we've got to be very conscious of that because it can have quite a serious impact, I think. Yeah. I think as younger and more informed individuals, we have a responsibility to debunk some of that and maybe say, no, that's nonsense. It's interesting. You say, I've been a doctor for 20 years. And my mum still tells me how to look after myself. Like, if there's something, you should be doing this, or you should be doing. I was like, I've been qualified 20 years. I kind of vaguely know what I'm doing.
Do they try and bring you like,
have you done this? Have you tried this?
Yeah.
Exactly. And then when I try to tell them, it could go one or two ways.
Yes,
they could either be like, stop worrying me. Don't, I don't want to hear this, blah, blah, blah. Yeah. Or they might actually take it on board. I understand the frustration we sometimes have with them because I'm like, I'm not telling you what to do, but I'm kind of trying to encourage you to do the right thing, and I wouldn't be doing it otherwise. It's not an easy combo. It really isn't. But I feel like we have a responsibility. We're better equipped, right?
Yeah.
We are talking about this here right now. We have that experience and that knowledge and information. Yeah. It's up to us then to pass it around, right? Yeah. And counteract some of the other nonsense that they might have heard. And trust me, my family hears all sorts of nonsense from all sorts of people. Some of it on screen at certain TV channels. And I'm like, please do not listen to them. They do not know what they're talking about. And it's my job to kind of balance that a little bit.
So other than the GP or 111, is there anywhere else that people can go for accurate information around cancer and this campaign? Yeah,
so there's loads of stuff online. There's various charities that do it. The NHS has lots of information on their website about cancer and cancer-related stuff, but there's everything from Cancer Research UK, the individual cancer charities. They're fantastic. Lots of stuff on there. There's loads of healthcare professionals that you can talk to. It doesn't always have to be a GP. Practice nurses are really good for information. Pharmacists are really, really good for information. Dentists can talk about certain cancers. Dentists, head and neck cancers and mouth cancers, dentists are incredible for that sort of stuff. So think outside the box a little bit. It doesn't always have to be your GP straight away. There are other routes of information, especially now when we're so pressurised. It's maybe a good idea to take advantage of some of those.
Yeah, that's so interesting. I never would have thought about the dentist actually, but they have access into your mouth. There's
Dentists are usually head and neck specialists. Yeah. Think of them as that. You know, obviously their specialist area is the mouth and the teeth, but they do so much head and neck sort of anatomy and physiology and all that kind of stuff. They're really clued up on that kind of stuff. And there are, you know, if you just happen to have an appointment with one and you've had a niggling symptom, it's worthwhile talking. If the symptom's in that region, probably wouldn't be going to my dentist and talking to them about my foot. I don't think that's going to be very relevant. But if it's in that sort of area, particularly with things like tongue and oral and mouth cancers, that kind of thing, especially if you're a smoker, especially if you're a heavy drinker, be extra vigilant with that kind of stuff.
We do know that's a thing in our community, isn't it, with the heavy drinking?
Absolutely. And certain habits like chewing tobacco, that kind of thing, that is a massive risk factor for mouth cancers. And that's a really common habit and practice in certain communities, in certain South Asian communities. And they may not realise that actually it's dramatically increasing your risk of mouth cancer.
Wow, so many more conversations just coming to mind about what we should be talking about actually with our daily
Just
practice.
be aware of it. Just be aware of that kind of stuff,
Is there any one thing that you would like our listeners to take away from this conversation? And if so, what would it be?
Don't be scared to talk. Don't. The worst thing you can do is suffer in silence. You are never alone. You are never the only person going through something. It's okay not to be okay, but it's not okay to stay that way. That's the thing I want to get to people, is that if you're worried about something, share it. If it's been going on for a long time, whether that's a mental health issue, whether that's a physical health issue, whether there's something going on in your life that you need to talk to somebody about, worrying about it never makes it better. But actually getting it out and talking to somebody and seeking help, especially if it's a physical symptom that's, you know, concerning you, is the first step in making sure it's either nothing at all or it's something that really needs to be dealt with. And the sooner you deal with it, 9 times out of 10, the better.
Oh, amazing. Well, thank you so much for your insight and your time. It's so, so valuable. So thank you, Dr. Ranj.
Thank you for having me.
For more information on cancer signs and symptoms, please go to nhs.uk/cancer symptoms. It's probably nothing serious, but as you've heard in our conversation today, it's better to be safe than sorry. Start having those conversations. Start looking up for your loved ones and carry on having those conversations if they haven't had it the first time. Or play them this episode, you know, again and again. You know, maybe get your auntie to hit like, subscribe and all of that. But until the next time, thank you so much, Dr. Ranj. It's been amazing.
Thank you.
It's been your girl, Nikita.
It's been your Tash.
And it's been
Dr. Ranj.
If something in your body doesn't feel right, please contact your GP practice. The earlier cancer is diagnosed, the easier it is to treat. And patients who are diagnosed at the earliest stages, like 1 or 2, are far more likely to survive. Diagnosing cancers early is vital. In fact, over 83% of people survive cancer if it is caught at the earliest stage. To find out more information on the signs and symptoms of cancer, visit nhs.uk/cancer symptoms.